Welcome to the UCSF Bridges Curriculum Faculty Development module on Systems Skills. My name is Sumanth Ranji, and I am the Chief of the Division of Hospital Medicine at Zuckerberg San Francisco General Hospital. System skills are one of the 7 core educator skills in the new Bridges curriculum. This module will enable you to define system skills for physicians, describe how students will learn about system skills in the Bridges curriculum, and find further resources to expand on your system skills. The Institute of Medicine has defined 6 domains of high-quality healthcare. Healthcare should be safe. Patients should not be harmed by interacting with the healthcare system. Healthcare should be effective. We should always use evidence-based practices to ensure that patients receive the care that they need. Healthcare should be efficient. As discussed in the module on high-value care, we should not waste resources or expose our patients to financial harm. Healthcare should be equitable, in that all patients should receive the same standard of care. Healthcare should be timely, in that we should not ask patients to wait or be inefficient in our use of resources. And healthcare should be patient-centered, in that we should always take into account our patients' values, goals, and preferences. System skills broadly refer to the skills physicians need to ensure patients receive care that meets these 6 goals. Why do we need system skills? We live in an era of unparalleled scientific advancements, many of which have been led by faculty at UCSF. However, our ability to provide patient care has not always kept pace with our scientific understanding of the basis of disease and the treatments that we have available. Data shows that the U.S. healthcare system is plagued with waste, quality problems, safety issues, and inequities. This has led to an implementation gap, where there is a gap between the care that we are scientifically capable of providing and what patients actually receive. But just as there are leaders at UCSF in our scientific understanding of the basis of disease and the therapeutics that are available, we have many leaders at UCSF in systems skills. Traditionally, medical education has focused on training individual physicians to take care of individual patients, one at a time, whether in the hospital or the clinic or the emergency department. Moving the discussion about medical education from training individuals to treat individuals to training physicians to work in teams and thinking about population health helps with the creation of generalizable and sustainable solutions in response to errors and quality issues. By training physicians to work and lead interprofessional teams to address health on the population level, we will be able to address many of the systems issues that plague the current U.S. healthcare system. In addition, a growing amount of evidence-based methods can be implemented to improve safety and quality. These involve technical skills, such as quality improvement methods and data science, as well as socio-adaptive skills, which include interprofessional teamwork, communication skills, motivational interviewing, and health coaching. Working collaboratively with other healthcare professionals will help ensure that all of a patient's problems are addressed and will help ensure that the health of the population improves. In the Bridges curriculum, our goal is that students should be positioned to act as change agents within the healthcare system. Students will learn the principles of systems improvement, the principles of implementation science, data management, and interprofessional teamwork. Perhaps most importantly, they will learn to apply these principles in real-world clinical environments to ensure that all the patients they encounter receive high-quality care. This will begin in year 1 of the new Bridges curriculum. Students will participate in a preparatory systems ground school. During their clinical microsystems clerkship in years 1 and 2, they will be integrated on a longitudinal basis into an interprofessional clinical team. This will blend clinical skill applications as well as opportunities for systems improvement, mentored by designated faculty coaches who have received specific training in both systems skills and traditional medical curricular skills. Students will further those skills through their experiences in core clerkships, working with residents and faculty on quality improvement and patient safety efforts. And then during the 4th year of medical school, students will have the option to develop further expertise in implementation science or related field as a deep dive project. The goal is for students to get hands-on, experiential learning opportunities to identifying systems issues and developing ways to solve problems. So what does this mean for faculty? Some of you may already be experts in these areas, but for some of you, these may be new areas of knowledge just as they are to the students. We do not think that faculty need to become experts in system skills, but faculty should have core knowledge and system skills in order to participate in continuous improvement towards the goal of improving the quality of care that all of our patients receive. What this means from a practical standpoint is the faculty should be able to recognize potentially unsafe patient care situations, engage in efforts to improve the work environment and the quality of care, and support students in the clinical environment. The main goal is to support students' efforts to learn system skills by supporting a culture of safety and demonstrating how to engage in system-level improvement efforts. To give an example of this, in 2013, my colleague Neeraj Sehgal published a survey of fourth-year medical students at UCSF in the journal Academic Medicine. In this survey, 56% of fourth-year students said that they would not speak up if they witnessed a potential error during a clinical rotation, and almost the same percentage said that they were not comfortable asking questions if something did not seem right. Students have a very important ability to detect errors in unsafe situations, and if we as faculty do not support a culture that engages students and encourages their input, then we are limiting our ability to provide our patients with safe care. All faculty have a role to play in encouraging systems improvements. UCSF Medical Center Continuous Process Improvement Office, in collaboration with the Bridges curriculum and the Office of Graduate Medical Education, has developed core training in continuous process improvement. This consists of short, accessible modules in 5 core areas: safety, quality, patient experience, value, and the lean operating system. These areas fall under the umbrella of system skills. Information about this training will be available at the CPI website and as part of the Bridges website. Thank you.